Give us just an update on the condition of Congresswoman Giffords.
Well, John, I spoke to both Dr. Michael Lamole, the chief of neurosurgery here, and Dr. Peter Ree, the chief of trauma surgery here, just a few hours ago. They said they continue to be pleased and encouraged with the Congresswoman's condition. She remains in critical condition, heavily sedated in what's called a medically induced coma for her comfort and her safety medically. She does have a breathing tube. She is on a ventilator, again, to support her respiratory status. Dr. Ree told me what he was most pleased by at this point is that she has not taken any steps backward. She has not suffered any of the secondary complications that can be such a problem for any trauma patient. So no signs of infection, no signs of pneumonia, no signs of continued bleeding, and the swelling in the brain seems to be under control. All of those good factors. Also, we can't forget about the other shooting patients here. Yesterday, all who were in intensive care unit were transferred to step-down units. 3 remain in serious condition and 6 in fair condition. So good news for those patients.
The word optimistic has been used in connection with her condition. What does that exactly mean? I mean, what are the parameters here of optimism in terms of recovery?
That's really the million-dollar question, John. When you talk about optimistic from a neurosurgical trauma standpoint, there is such a wide spectrum of possibilities. Some people may remember Bob Woodruff, the journalist who sustained a major brain injury. Some people also may remember James Brady during Reagan's assassination attempt. There we see kind of the end extremes, if you will, of what could follow a gunshot wound or traumatic brain injury and everything in between. The reality is, for the Congresswoman, it is way too early for her surgical team to comment on that specifically. They remain encouraged that she has not taken any steps backwards, that she is able to follow simple commands. Particularly, I asked Dr. Ree today, when she's able to show 2 fingers, she is able to show 2 fingers on both sides of her body, with one being stronger than the other. But that is an important prognostic indicator, because at this point, it shows that she would not be completely paralyzed on the right side of her body, which is the opposite side of the bullet injury. So very good news at this point, but her road to recovery and her prognosis will be measured not just in days, weeks, and months, but probably in years.
Are the doctors giving any indication about what they've been able to find out? Obviously, from doing the surgery, they know where the damage was, but in terms of their assessment, you mentioned the 2 fingers. Are there any other areas that they'll be looking at in the near future to get a sense of damage? Any other tests they'll be looking for that represents the next possible stage of development in her condition?
Well, a couple of things that will help people understand this situation. As most people are aware by this point, the injury did occur on the left side of her brain, which in general controls our language and speech center. All the doctors here are saying, in terms of the specific path of the injury, is that the bullet entered the left rear part of her brain and exited the left front part of her brain, and miraculously spared any major blood vessels and any major deep internal structures in the brain, which control so many other vital functions. They are not specifying exactly the location due to the family's request, and they've been excellent about that and really protecting the Congresswoman's privacy as we would any patient. So when you talk about her recovery, yes, we have to be concerned with her ability to speak, which they don't know at this point. She's not yet able to open her eyes, and they have told me that yes, the brain is a very unforgiving organ in terms of small injuries can result in very large deficits, as we call them, but it's also an incredibly miraculous organ and can compensate in unbelievable ways for injuries that have been sustained. So the fact of the matter is, at this point, they don't know what kind of deficit she will have because, again, she does remain in a critical condition. I also want to point out that her medically induced coma, her chemical sedation, is with an anesthetic agent called propofol. And when they test her periodically, because you asked about testing, they just cut that IV off temporarily and the body rapidly clears that drug, she's able to become a little more alert, less sedated, and then follow their commands. So that's one type of the neuro test that she goes through every day. She is getting daily CAT scans of the brain at this point and chest x-rays, again, to look for continued bleeding, swelling in the brain, infection in the lungs. That's standard for any neurosurgical ICU patient.
Amazing. Dr. Jennifer Ashton, thank you so much for your report from Tucson.